Good afternoon and welcome to the Calcasieu Parish COVID-19 public briefing. My name is Brian Beam. I'm the administrator for the Calcasieu Parish Police Jury. We've got some good, updated, very new information today from our various speakers, and we will get right to it. We will start with Dick Grimion, Director of the Calcasieu Parish Office of Emergency Preparedness, and immediately following him will be Dane Boland, Assistant Administrator at the parish, who will give us a very new update on mask distribution to local businesses. So we'll start with Mr. Grimion.
Thank you, Brian. Last week we announced that we would be moving to phase 2 in our testing, and so we've moved now to what's called community-based testing. We're actually moving around different places in the parish. This week we did Tuesday at the Civic Center, Wednesday in Sulphur, and then back again to the Civic Center today. Next week we will be at Vinton City Hall on Monday, May the 11th. May 12th, Tuesday, DeQuincy City Hall. May 13th, Wednesday, Iowa City Hall. 14th of May, Westlake City Hall. And then a new addition today will be at Moss Bluff Middle School on Friday the 15th. Now all of these dates are dependent on the weather. We're going to have some rain tomorrow. Of course, we're not testing tomorrow, but we'll make a call the day before if we're going to cancel a testing. The testing has been very good. There's a lot of interest out there. Monday we tested 100 people at the Civic Center. Yesterday at West Calcam Marina we tested 101, and then again today at the Civic Center 116. And unfortunately we had to turn some cars away, but we're giving them the information on where to go to the other sites. We found that we can handle, the way that it's set up currently, we can handle 100 people per day. And it's primarily because the tests have to be sent off. We have to meet a courier at a certain time each day to give them the samples. So for sure, if you missed a date, try to go to one of the other sites, or we may come back to you at a later date. And I'll ask Dr. Cavanaugh to comment on the reason for doing the testing, but primarily two reasons. One is just to get a better sample of what the whole community looks like. The medical requirements have been dropped, so now we can get a look at maybe people who are not sick. The numbers that we had were based on primarily on sick people. The other thing is try to identify people in the community who may be what they call asymptomatic. These are people who are not showing any symptoms from COVID-19 but could be a carrier of the disease, and they're trying to at least locate some of them so they can identify those in the community as well. And with that, I'll turn it back over to Brian, or to Dane, I'm sorry.
Thank you, Dick. I want to report that today was really a good day for the mass distribution site at the Burton Complex. We had over 400 local businesses come through, and at the end of the day, we hope that over 20,000 masks will be distributed to the local businesses. Again, it's a very efficient process. I think that the longest someone had to wait was 8 to 10 minutes. And I want to thank the Chambers of Commerce for both the East and West Side, and also the Ward 3 Marshal's Office. They did a great job out there keeping the flow going. Also, if you're unable to pick up your mask, if you're a local business and for whatever reason you couldn't get there today, please call us at 721-4027, or you can email us at recoverymask@calcasiewparish.gov, and we will make arrangements where you can pick these masks up for your business. Also, we hope to hand out 20,000 masks today, so if you get masks, please don't put them on the ground. And always remember, pick it up Calcasieu, so we want to control our litter issues throughout the parish. Thank you. If you have any questions, I'll take them now.
The masks that you're giving out, are there any that are left over perhaps that the public could have? And are these masks that can be reused and washed every week? And if so, how often should people wash these masks? Any idea?
Thank you, Tree. They are washable masks. You can wash them. I'm not the expert. Maybe Dr. Cavanaugh could talk about how you can wash them, but I've talked to some people who wash them every other day and having a extra to go back and forth and washing them like that. And as far as extra masks, what we're going to do is after today, we're going to regroup. Look at phase two, if there's going to be a phase two of mass distribution to the parish and what that looks like. I think next week the governor will probably give some direction on the state's phasing in system, whatever that may be. And I'm quite certain that mass will play a role in that. And once we see that, we'll make some decisions based on that.
For the public?
Yeah, stay tuned on our website if we decide to distribute masks to the public. Thank you.
Thank you, Dane, and we want to greatly thank local businesses for coming to get these masks. It's so important. The more we have being utilized out there, it'll encourage more people to go to their places of business, but following safe guidelines. As we turn it over a little bit to the medical side, just a reminder, in any emergency, you've got to simultaneously look at what's going on now, like the case counts, very important, but at the same time also look ahead weeks and maybe even months. And I want to really applaud Dr. Cavanaugh's efforts. She's been great for Region 5 and always letting us know what we need to be thinking about ahead a little bit, and I think she's going to focus a lot more on that now, so I'd like to turn it over to Dr. Lacey Cavanaugh, Region 5, Director of Office of Public Health.
Hey, good afternoon, everybody. Thanks for the introduction. Today I'm going to take a little bit of a different course, and I'm not going to go straight to the numbers, because one of the things that I think you'll see going forward is that there'll be actually a little bit less focus on the numbers. We know you're trying to substantially ramp up testing, and you've seen those efforts happening here locally to do testing en masse. And one of the reasons that we want to test more people, because we need to get a better idea of how many asymptomatic spreaders we have within the community. Recent studies are actually showing that the people who have symptoms may be the tip of the iceberg in many communities and cases, and that there could be a large number of people who are not displaying symptoms, but who could get other people sick. And so by doing sort of kind of a more broad-based testing strategy, that will really allow us to collect enough data to know where we have a problem before we start having bunches of hospitalizations from spread within the community. We're not just looking at numbers, once again, because as we test more people and as we broaden those criteria, we know the numbers are going to go up because we're going to find these asymptomatic spreaders. But that doesn't mean that the disease is spreading more within our community. It just means that we're actually testing those people and catching those cases now. And so although you'll still see the numbers come out on the website daily, and of course we're still looking at that, we also have to take into consideration how many tests are being done when interpreting those numbers. So if you have 10 positives in an area, but you've only tested 10 people, then that's a much bigger problem than if you have 10 positives in an area and you've tested 200 people in that area. And so we definitely have to take all of these numbers and take them into context, especially as we rapidly expand testing across the region. We're also following things like hospitalizations, but once again, hospitalizations happen after somebody gets sick. If we can identify the people in the community who have COVID before we start seeing a huge number of hospitalizations, then that's actually the ideal situation and sort of what we're shooting to do. We're also monitoring some other data points, including what you may hear of as COVID-like illness. So the same way that we monitor flu, so people who, say, go to the doctor's office with a cough and a fever, so they have flu-like symptoms, we monitor the percentage of people who go to clinics and in outpatient settings with those symptoms to know when we start to see spikes of flu within the community. So we're actually going to be looking at data as well that shows how many people in the community are visiting doctors for symptoms that could be compatible with COVID, and using that sort of as as one other data point, taken in context with many others of what the burden of illness looks like within the community. So the data piece, although it's still not perfect, I know the reporting is not perfect, but it is continuing to get better over time as we gather more data. And I'm really hopeful that we'll have negative data broken down into a parish level so we can really make those calculations going forward. And that's something that I'm looking forward to seeing as that becomes available. So I'm excited about being able to see that. I wanted to spend a few minutes once again. I know we've talked about this before, but when we say testing, what we are really talking about is PCR testing that detects people who have the virus in their system who could spread it to other people. That's different than what you may be also hearing about, which is antibody testing. Antibody testing is testing to find out if your immune system has built up a response to this virus. Antibody testing until this point in time has been sort of unreliable. It tended to cross-react with common colds, coronaviruses, and we're not really sure of what the utility of those tests are, but they are getting better. And I'm excited to say that I've heard of a few local places in the community that have some antibody testing that seems to be of quality and is specific for this coronavirus that we're fighting, for the COVID-19 coronavirus. And so as that becomes available, it will be interesting from a statistical standpoint to really see how many people could have had this previously and we didn't know about it. Now, what I want to make sure that people don't do is they don't assume that just because you've had it and your immune system has mounted a response to it, that does not necessarily mean that you will be immune in the future. You could be, we just don't know yet. This thing hasn't been around long enough for us to really know what level of antibodies you need in your system to actually be able to prevent you from getting it again. And so I think that information about that is going to become more widely available as time goes on and as we get a better grip on the testing. Now that we have a reliable test, we'll be able to collect data and really start to see what that data means over time. So, but when you do get a test, make sure that you know what kind of test it is, because the interpretation is different. If you got a negative antibody test, but you're coughing, then that doesn't mean that you don't have COVID. It means your body may have not mounted an immune response yet, and it could take a week or 2 weeks before you turn positive on that antibody test. So definitely know what kind of test you're getting, and make sure that if you're sick, you're getting a test that looks for virus in your system right now, not a test that looks for if your immune system has responded to that virus. So there's definitely a big difference there. Another really big thing that, two big things that we're sort of looking forward to in the next few weeks is one, we are working on development of a contact tracing program, a very robust contact tracing program. And what that does is it allows us to identify people in the community who have COVID and make sure that we connect with them and that we also then get a good history from them and identify all of the other close contacts that that person has had, whether they have symptoms or not, and then hopefully eventually be able to get all of those people tested so that we can prevent people from actually spreading the virus that way. And many other states across the United States have been working on development of these contact tracing programs. We have been working hard on that too. We do know it's going to take some additional workforce. The details of how that program are going to run are definitely still being debated, and I do think that you will hear from state level leadership going forward of the specifics of how the plan is going to work. But we definitely are very aware that this is a need, and we are planning accordingly. And that includes looking at our workforce and making sure that we have enough workforce to actually accomplish that task. We are doing it, and we actually have been contact tracing here locally since the very beginning. Because our region has fared pretty well, even just our public health nurses and our local epidemiologists have managed to actually continue to contact trace through this outbreak so far. And so that's good. But as we move forward, we're definitely going to need some additional workforce to be able to make sure that we're doing a good job, because as people start to move around more, they're going to have more contacts. And as they have more contacts, this gets very rapidly gets more complex. Right now, people's contacts are mostly in their households because people have been staying home. But as that model changes to a model that we're all getting out into the community more, then the contact tracing becomes more difficult and will require a larger workforce. So the second thing that we are spending a lot of effort and focus on is on making sure that we are supporting our nursing homes and assisted living facilities and group homes and other vulnerable populations, including homeless individuals and people who may be incarcerated or anybody else who lives in a setting that could be communal. Because we know that this virus is extremely contagious, and we know that there have been a lot of deaths, both nationally, on the state level, and on the local level from vulnerable populations. And so we have to make sure that we have good access to testing there. The CDC did come out with some new guidance this week that suggested some level of surveillance. So just going into these sorts of facilities and offering mass testing within them to try to identify those asymptomatic carriers the same way that we are doing in the general population. But I definitely think you'll see an increased focus on making sure that those facilities have all the tools they need to effectively prevent disease spread and ultimately prevent death in those cases. So definitely a lot of planning efforts going into that initiative. So that's kind of wrapping up the testing piece. And I'd just like to mention briefly that our region really has done well. Our hospitals have done well. Our level of hospitalizations has stayed pretty flat. We haven't had a huge increase of cases. It's definitely been slow and steady and very manageable. So I think that people here in Southwest Louisiana have really done a wonderful job of following guidance and of hand washing and of all of the social distancing that we've been asking you to do. So I thank everybody for that, because definitely I think we could have done a lot worse, and we've done a great job, and the numbers certainly reflect that, because we're in a good place in terms of disease burden in comparison to a lot of other places across the country. I will say, though, that as we try to move into what we're calling some sort of new normal, I want people to realize that it's not going to be the normal that we knew in January and February of this year. Even as we start to move into phase one at some point, whenever that may be, we're still going to have a very focused effort on social distancing, on hand washing, on wearing masks when we're near other people. And we're going to have to continue to do all of that. So a lot of things that we're used to doing are going to be different and are going to change. And so we need to be patient with that. It's not going to be a full throttle. We have to do this responsibly. So I'm going to leave it there and open up for questions.
As far as the nursing homes go, some states list the names of the nursing homes and how many deaths they've had from COVID. And some people in Louisiana think that Louisiana should do that. What, if anything, can you tell me about whether the state is going to change and go ahead and begin identifying the homes and how many deaths they've had?
You know, I haven't gotten any word about if and when that may happen. I have seen nationally big pushes to try to be more transparent with that information while still protecting the privacy of the residents and the families who are at that home. So I definitely think it's a balance. And unfortunately, I can't give you an answer in terms of when and if more specific information is going to be released here in Louisiana. I do know that many people have asked that question, and so it has definitely been a topic for consideration and discussion.
Could you please go over who is required to wear a mask versus who should wear a mask and it's not required?
Right. So anyone who is working in a industry or in a job that is publicly facing, that comes into contact with the general public, those are the people who are required to wear a mask, as I understand. General population members are not required to wear a mask, but are definitely strongly recommended to wear a mask as long as they are able, given their own medical history. And mask washing, I'll comment on that since there was a question on that earlier. And masks really should be washed anytime they are worn. So if you wear your mask all day, you need to wash your mask at the end of the day, and that's every day.
All right, thank you, Dr. Cavanaugh. We're going to hear next from our police jury president, Tony Gilry.
Thank you, Brian. And on behalf of the entire police jury, I wanted to thank our staff and our partners for the tremendous success of today's mass distribution. This is a great example of our community coming together at a time in need. Thanks to our staff again, the Chamber Southwest, and West Cal Chamber and all the businesses that came out to get masks to keep their employees and customers safe. I also wanted to thank our staff and partners involved in the new COVID-19 testing program that got underway this week. It's another example of how our citizens are coming together. Thank you. And to all residents of Calcasieu Parish, please keep up the great work for the social distancing, and we will get through these difficult times together and stronger. Thank you.
Appreciate that, Tony. Before I turn it over to Mayor Hunter, I just want to mention he and I both participated this morning in a video conference call with several people from around the state and really the world planning for this LNG Summit of the Americas in November. My point in saying that is that while the COVID is the issue now, we also have to look ahead and plan ahead for the economy of our area, and I was very encouraged by this call. They're excited to be coming. There are a lot more to be planned, but nothing's done in a vacuum. So while COVID is continuing to be dealt with, we have to do all those other services well, and I think Mayor Hunter probably had a similar reaction that I did and felt very good about it, but I'll let him talk about that and any other matters regarding COVID. Nick?
Thank you, Brian. Good afternoon, everyone. Just a few updates from the city of Lake Charles. Some of you may know that this past Monday, May the 4th, we opened up Mallard Cove Golf Course, and that was a great success. We're encouraging social distancing at Mallard Cove, and the golfers are able to get back to a recreation that they enjoy very much, and so that has been a great success so far. Also, May the 6th, yesterday, we restarted our recycling program, and we received a lot of excitement about that. I know that a lot of people had garages that were starting to get stacks very high with recyclables, and so the citizens are excited about that as well, and we're happy to provide that service. I want to challenge our community and our citizens to be cautious right now in this day and age. There's so much noise out there, and when I get home from work, I get on YouTube a lot, and I get a lot of my news from YouTube, and I just like to watch some clips on YouTube. You can find someone on YouTube that says the earth is flat. You can find someone on YouTube that says the sky is green. And there's a lot of noise out there right now. And I understand that people want to find some very, sometimes succinct answers to what we're going through right now. And with all of the noise, sometimes it's difficult to know which voices to listen to. I can tell you that for me, just Nick Hunter speaking as a citizen, I trust people like Dick Grimion. I trust people like Stitch Guillory. I trust people like Tony Mancuso, Dr. Lacey Cavanaugh, Dr. Tim Heyman with Christus, Dr. Manley Jordan with Lake Charles Memorial Hospital, Emily Ashworth with Southwest Louisiana Center for Health Services. I trust those people. And those voices carry a lot of weight with me when we're talking about this pandemic we're going through. As I say that, I also trust the voices and the people of Southwest Louisiana. I trust our business owners. And so we in local government continue to monitor this situation daily. I do believe that Southwest Louisiana is ready to reopen in a way that is safe and healthy and taking our citizens' livelihoods and their health into precaution. And I believe that our cities and parishes are communicating. I can tell you here in Southwest Louisiana, the cities within Calcasieu Parish are communicating with OEP and the police jury on our plan, our local plan for reopening businesses and how that's going to look here in Southwest Louisiana. There's been a lot of discussion about that. it would be premature to complete that plan before we hear from the governor. And we're very hopeful to hear from the governor on Monday, May 11th. That's kind of the word that we are hearing, and that there will be some perhaps timeline laid out. But again, I believe we're ready to open here in Southwest Louisiana, and I believe that government, law enforcement, the medical community, business owners, and citizens working together can do it in a way that is safe and healthy for our citizens, but also a way that can gradually get our economy back rolling. I want to end my comments on a positive note, and I want to let everyone know that we made the decision, the City of Lake Charles made the decision not to completely cancel our Downtown at Sundown series, and that Friday, May 15th, we will have a virtual Downtown at Sundown. And if you want to enjoy the sounds of the KC Pivotal Band and Rusty Matoyer and his band, you can check that out on the Downtown at Sundown Facebook page that evening. It'll be live streamed. And what a great opportunity to have some great entertainment and just a reminder that we're not going to lose who we are here in Southwest Louisiana. We're not going to lose our culture. And this Downtown at Sundown series, I think just streaming even just one live performance that evening will be a nice breath of fresh air for everybody. So I encourage everyone to check that out. And you can find out more information about that on Downtown at Sundown's Facebook page or on the city's website. Those are the comments from me today, and I open it up for any questions if there are.
Mayor, do you have an opinion on this move to let parishes go their own way if it turns out that they disagree with whatever the governor decides on May 11th?
Well, I have voiced my opinions very strongly to the governor and to his administration, to our state delegation, and to members of the Resiliency Task Force. It is my belief that the governor should reopen the state of Louisiana and allow local elected officials the option to be more restrictive for their communities if they choose to do so. I don't think that we need that here in Southwest Louisiana, and so that's my opinion, that he should open up the state of Louisiana and allow locals to be more restrictive if they choose to do so.
All right, thank you, Mayor. Next, we're going to have Stitch Gilry, Chief Deputy for the Calcasieu Parish Sheriff's Office, and he's joining us remotely.
Thanks, Brian. I just want to reiterate that on the law enforcement end, everything is going well. We're conducting business as usual. As you can see, those of you that read the newspaper, we're making arrests every day, unfortunately. We have noticed an uptick in traffic. Traffic has gotten a little bit heavier the further along that we've gotten into this. But, you know, just to reiterate what Mayor Hunter and Dr. Cavanaugh said, you know, we have a number of deputies out there every single day interacting with the public. And we're practicing the guidelines that are set forth by the CDC. We've been very fortunate. We've had 8 deputies that tested positive. So far, 7 of those have returned to work, and we've had 1 that is still out and hopefully will be back soon. And so with the number of interactions that we have with the public every day, yes, that could happen. But with the contact tracing and doing everything the right way, the Sheriff's Office is proof that, you know what, we can beat this virus if we just do the things that we're supposed to do every single day and practice our social distancing and wash our hands. And, you know, it's something that we have to live with as the new normal. But as I said, the Sheriff's Office is living proof that you can live with this virus and beat it. So we're just asking people to continue to be positive with what we're doing and the way that we're conducting ourselves, and together we can beat this virus. So that's my message for today.
Okay, thank you, Stitch. We have today with us Denise Durrell, Executive Director of the United Way of Southwest Louisiana. and she's got some good news for us today.
Thank you, Brian. I'm very excited to be able to announce that United Way and some of our partners, including Second Harvest Food Bank and the Calcasieu Parish Sheriff's Office, are actually going to be hosting our third food distribution event on Tuesday, May the 12th, from 11 to 1 at the Preon Lake Mall. Now, we're going to be passing out 100,000 pounds of perishable and non-perishable foods. This is a non-contact drive-through event, and we're going to be servicing 700 cars. It equates to about 142 pounds of food per car, so therefore it is not suitable for walkers or people who are arriving on bicycles. We know that we want to encourage people to enter on Preon Lake Road into the mall and head towards Home Goods. The Sheriff's Department will be lining people up. This time we're also going to be counting off the cars. So you will know if you are car number 700 or if you are beyond that number, and we are going to let you know at that point that we're probably not going to be able to serve you. We actually just decided yesterday to host this event, so we are in need of volunteers. So if you are free and would like to participate, please call the United Way office at 433-1088. We are in need of volunteers to help us make this happen. If you're food insecure or you know someone that is, please help us share this message. And you can also, if you don't remember the details, anyone can call 211 to obtain information again about this event. We actually last week hosted 2 previous events in Calcasieu Parish, and I'm happy to report again with our partners, the Sheriff's Department, Second Harvest, and United Way, we were able to provide 166,000 pounds of food and service 4,522 families here in Southwest Louisiana. So again, we're happy to be here and happy to be able to announce this today. And again, help us spread the message. If you're food insecure or know someone that is, please join us on Tuesday, May the 12th.
That's great news. We want to thank Denise and the United Way and everybody involved, Sheriff's Office and others. That is such great news, and it's a reminder that there's a lot of people in need just for basic food and other necessities, so we appreciate that. That ends our list of speakers for today. This is a time for any general questions and answers if there are any. Any others? Teresa says there's no more questions. Okay. Well, then, we appreciate everybody viewing. We are still continuing to do these weekly until further notice, so the next public briefing will be scheduled Thursday, May 14th at 2 p.m. Thank you.